Vitamin C or ascorbic acid is crucial for various bodily functions including cell protection. It acts as an antioxidant, safeguarding cells from free radical damage, which can contribute to heart disease and cancer. Tissue health. It supports healthy skin, blood vessels, bones, and cartilage. Wound healing. It is essential for the repair of tissues. Iron absorption. It enhances the body's ability to absorb iron from plant-based foods. So, where do we get vitamin C from? Common sources include citrus fruits like oranges and lemons, berries like strawberries and black currants, vegetables like peppers, broccoli, Brussels sprouts, and potatoes. Adults aged 19 to 64 need 40 milligrams per day, typically obtained through a balanced diet since vitamin C isn't stored in the body. A lack of vitamin C can lead to scurvy, characterized by anemia, bleeding gums, and poor wound healing. But beware of overdosing. Consuming more than 1,000 milligrams per day can cause stomach pain, diarrhea, and flatulence. These issues usually resolve upon reducing intake. A varied diet should provide sufficient vitamin C. Supplements are generally unnecessary but safe if kept below 1,000 milligrams daily. Let's see what the research says. Diets high in fruits and vegetables may reduce cancer risk, though direct links to vitamin C are unclear. Vitamin C may slow age-related macular degeneration in eyes when combined with other nutrients. Any interactions? Let's uncover. Vitamin C interacts with aluminum medications, potentially harmful for kidney patients. It also decreases the effectiveness of chemotherapy drugs. Interactions are also noted with certain antiviral drugs and cholesterol medications as well as estrogen therapies, possibly increasing hormone levels. Always inform your doctor about vitamin C supplementation as it may interfere with medical tests and other treatments.